Good morning, everyone. We appreciate you joining us today to spread the awareness about stroke and its rehabilitation. Just a note for better quality, please change your settings to 720 pixels. So here we have today myself. My name is Akshata Rao. I'm a neurophysiotherapist by background, and I lead the stroke rehabilitation department here in Nightingales. And along with me, I have Divya Kalyanpur. She's a speech language therapist from Nightingales Home Health Services. So before we move any forward, it's very important that we understand what a stroke actually is. Many of us think that stroke is actually heart attack, but stroke is a brain attack, and it's also a medical emergency. What essentially happens in a stroke is just like any other organ in the body, a brain also requires nutrients and blood supply to survive. So if there's any clot or if there is due to any reason, if the blood supply to the brain stops, it leads to stroke where the brain cell starts dying. In India, nearly 1/5 of patients with the first stroke is estimated below 40 years of age. So here's another myth for us where most of us think that strokes generally happen in older people. It is not actually true. And sadly, younger people are the ones who tend to ignore the symptoms of a stroke because they think that strokes cannot happen at their age. Now, depending on which area of the brain is involved in a stroke, the stroke symptoms will differ in each person. Therefore, not all strokes are the same, and every individual who suffers a stroke will have different symptoms, and the rates of recovery will be different. So just want to talk about what are the types of stroke. Now there are two main types, and out of which one is ischemic stroke. This is the most common kind of stroke, and it's mainly caused due to a clot. 80% of the strokes that we see are because of ischemic strokes. This is nothing but a blockage in the artery which supplies to your brain. The second kind is a hemorrhagic stroke. Now this is most commonly due to somebody who has high blood pressure. So what happens, the artery essentially bursts and there is bleeding in and around the brain. So sometimes the effects can be far more severe and people go into coma. It can also lead to death. It's an alarming fact is 1.9 million brain cells die per minute as soon as someone has a stroke. And I cannot emphasize it more. This is an immediate, therefore you need immediate treatment in an emergency department. So we're talking about strokes and its effects which are so severe. So how do you identify if someone is having a stroke? There is a test called as the FAST test. FAST essentially stands for F is face, A is for arms, S is for speech, and T is for time. What you do is, if you suspect that someone's having a stroke, you check whether, you ask them to smile and you see whether their face is drooping on one side. If it's a yes, then probably this person is having a stroke. The second thing to look out for is you ask them to, raise both their arms. If one arm is drifting down, then this is indication number 2 that definitely, yes, something's wrong. Then you ask them to repeat a sentence after you. If their speech is slurred, if they're not able to speak, or if they're speaking something which you don't understand, then it's definitely a stroke. Stands for time. This is the most important part. Now this person has to be taken to a hospital immediately. The other signs and symptoms of a stroke essentially would be sudden onset. Again, I would like to repeat the word sudden is very important because the symptoms, if somebody gets a numbness in the arm, that's essentially a stroke. If somebody gets a sudden numbness or a sudden weakness in their arm or leg, if they have confusion or trouble speaking, some difficulty in their vision where they're not able to see things clearly, some people might have loss of balance and they might have dizziness. Some patients also complain about severe headache. These also could be potential warning signs of a stroke. One more thing here is a mini stroke. So what is a mini stroke? Not many people are aware about this. A mini stroke is also called as a transient ischemic attack, and it is a warning sign of a stroke. So what essentially happens is, just like in a normal stroke, there is a blockage here in the artery in the brain, but there is a blockage, but this is a temporary blockage. After some time, it passes off. So the symptoms are not severe. The symptoms might last, all these symptoms which I mentioned, those numbness in the arm, weakness in the arm, these are very transient. They last only for 24 hours and then it's gone. But this doesn't mean that you just ignore it. this also requires medical attention, just like a full-blown stroke, because this is essentially telling you that a storm is yet to come. This is a warning sign of a bigger stroke. Many patients tend to ignore this, which is therefore we say, strokes can be prevented if these signs like a mini stroke or a TIA are paid attention to.
Moving on to the symptoms of stroke. People tend to assume that after a stroke, the only symptom is paralysis. Paralysis is one of the main symptoms of stroke, but symptoms depend on which area of the brain has been affected. Some of the symptoms, as you can see, is memory loss, speech difficulties, balance and mobility issues, depression or anxiety, emotional outbursts, or even struggles with daily tasks like dressing, hygiene, writing, or any such daily activities. Moving on to what's preventable and treatable. Stroke is preventable and treatable. It's something to keep in mind. The main thing is the golden window. Okay, if prompt treatment is given within 4.5 hours of the onset of stroke, this increases your chance of survival and improves the likelihood of recovery. The second factor to keep in mind is the compliance of previous medications, if any. What happens is you might have a previous ailment such as hypertension or diabetes where you're on medication. It's very important to continue the medication as per your advice of your doctor. These are the common risk factors in stroke. As you can see, the main factor is blood pressure. Second one is the identify atrial fibrillation, smoking, alcohol, controlling your diabetes, managing your diet or exercise, treating any circulation problems, and getting your cholesterol screened at the earliest. Now, some of you might think, what would you do post-stroke? If you or someone else is having a stroke, these are the main things to keep in mind. The first step is, like Ata mentioned, is immediately taking the person to the hospital and getting emergency treatment. Second is a consultation with a neurologist or the neurosurgeon there. Now, once a patient gets discharged, another important factor that needs to be kept in mind is initiating early rehabilitation at home at the earliest. Rehabilitation can consist of the physiotherapist, a speech therapist, occupational therapy, depending on what symptoms the patient has had post-stroke. Now, the physiotherapist, speech therapist, or occupational therapist would make an individualized treatment plan post-assessment, and regular intensive therapy would be started.
So just a quick note I want to add here. Emergency treatment in a hospital, we come across many patients. What they do is, as soon as they identify that, yes, this patient had a stroke, or maybe there's something wrong with this patient, they tend to go to their general physicians. And the physicians are a little helpless there, because if someone's having a stroke, it's very important to identify whether it's because of a clot or whether it's a hemorrhage, because the treatment for each will be different. If it's a clot, the doctor might give a clot bursting drug so that the circulation can assume. And if it's a hemorrhage, the treatment, it could also require surgery. So treatment in a hospital is paramount. You need to go to a doctor, yes, but to a hospital where they have these emergency medical services and access to probably CT, MRI. And coming to rehabilitation, so what rehabilitation is, I've come across many patients who just are like, if someone's had a stroke in their family, they're like, okay, we want physiotherapy. And sadly, the first thing they want from treatment is they just want to walk. Every patient wants to walk so that they can be independent. But something to understand here is the way the body recovers after a stroke, the face, the arm, the leg, everything doesn't recover at the same rate. Depending on the kind of stroke, again, there is a kind of stroke in which the arm is more severely affected. And mind you, this is the most common kind of stroke which affects the middle cerebral artery. There is another stroke which affects the leg more commonly, but again, it's not seen a lot in patients. So therefore, if someone emphasizes that, yes, I want to walk only, you're missing out on the opportunity. So, see, as soon as someone has a stroke, you must have heard many people say, or doctors say that, your initial 6 months, that's golden period where you need to do intensive therapy to improve. But patients generally just start with physiotherapy. What they ignore is the movement of their arm. Also, what they ignore is their speech. Speech is a very high level function. Let me explain this. So for walking, you need not, it's very automatic. You put the patient on the ground, the patient starts walking because he has a normal side. But you imagine speech, the patient has to understand what's being said, the patient has to think of an answer, and then they have to actually reply something which is relevant to what's being asked. So speech is a very high level function, just like physiotherapy. Speech therapy also is very effective if started immediately after a stroke. If someone waits for a very long period of time, that okay, let me start walking first and then maybe I'll start speech therapy, the patient might have lost that window of opportunity to improve better. I'm not saying that the patient will not improve at all, but the effects could have been much better if speech therapy was started early. That's what we mean by, initiating rehabilitation early during the rehabilitation phase. So rehabilitation is a big umbrella, and it's essentially a multidisciplinary team which involves different specialists here. One among them we all know about is a physiotherapist. And yes, a physiotherapist will help a patient with the movement. Physiotherapist essentially helps with movement. Movement meaning turning in bed, doing your transfers, sitting on a chair, walking, using your arm. Many of them are not aware about an occupational therapist. An occupational therapist will help you get back to all your daily activities. We tend to, if you've seen any patient getting any physiotherapy session, you would see that they're moving their arm, they're trying to walk, sitting to standing. All these are common exercises. But what about grooming yourself, wearing your clothes, putting the buttons of your shirt, wearing a shoe? These are the most important activities which we actually need to do. This To do these activities, the reason we are doing physiotherapy is because we want to do these activities. So occupational therapy again is a very important aspect of rehabilitation. Now along with this, stroke is caused because of high blood pressure. I mean, if you've seen the previous slide, the main reason strokes occur is because of high blood pressure. So as a physio or as a speech therapist, we cannot manage blood pressure. So that's why we have physicians on board who prescribe medications, look after the diabetes, the cholesterol, to keep them in check so that there is no further adverse effect because of these comorbidities. Also, imagine a patient who's bedridden, someone who has been paralyzed for a very long time. Sometimes they might have a bed sore, or sometimes they need to be catheterized, where a pipe is put on and a bag is attached to the patient so that because he cannot walk to the toilet. So nursing is again a very important aspect of rehabilitation. So the idea of rehabilitation is just that it is multidisciplinary in nature and different specialists are involved so that a patient gets 360-degree care. Moving on, coming to the recovery.
There are 3 parts to it. Okay, one is it depends on the severity of the stroke, how severe it is, where was the bleeding, where was the clot. That will matter. Second is the methods. Okay, it depends on the type of the brain damage. And third is the recovery, which is usually can be lifelong, or you can even, in case it's an ischemic attack, recovery can be soon, but you have a higher chance of getting another stroke. So now one thing many people think, wonder if complete recovery does take place after a stroke, but you need to remember that brain cells which are badly damaged at the onset die and never recover. But the other parts of the brain which were unaffected during the stroke begin to take over the functions of the dead parts only to a limited extent. This is known as neuroplasty. Patients adapt to the loss of functions and learn new ways of living after the stroke. Okay, because it's not easy, it does take time, and they do have to adapt to slower rehabilitation, getting used to moving an arm, getting used to talking in a different manner, because all that was lost during the stroke has to be relearned and to relearn to live in this kind of a life.
So just adding on a bit to recovery, here's your answer to the question that, so if my brain cells are dead, how do I recover? So that's the answer. Neuroplasticity is a hot terminology in neurorehabilitation. It's not just your arms and legs we are working on. We are working on the brain itself because your brain has been affected by a stroke. So that's all for your awareness about stroke rehab. If you want to know any further information about stroke rehabilitation services we provide in Nightingales, we have 3 regions: Bangalore, Hyderabad, and Mumbai. You can contact us on the following numbers. You can also visit our website on www.nightingales.in. So we are now open for any questions that you have. So Ishan has asked, I thought the arms are paralyzed after a stroke. Then why is the arm so tight and difficult to move? Okay, to answer your question, Ishan, that's actually a good question. But like I said, initially, as when a patient has a stroke, the most common symptom is paralysis. Yes. So initially, when someone will have a stroke, their arms will be completely paralyzed. It will be having a very flabby appearance, flaccid appearance rather, and they'll not be able to use it at all. But as and when the recovery happens, what tends to happen is because it's paralyzed, they tend to keep it in certain wrong positions. It's called adaptive, uh, you know, wrong postures basically. So as and when time passes, there is something called as spasticity which begins to appear. Spasticity occurs in certain patterns only, where the arm can only move in certain patterns. It's not just possible to move only your shoulder or only your elbow. So that's why you see patients generally, if they're trying to move their arm to reach out for something, their entire top half of the body moves. But it's scary as it sounds, but the recovery is such that spasticity will peak, but as and when time passes, spasticity comes down as well, and individual joint movements do become possible. This is possible only with vigorous rehab. The more practice you do, the more number of repetitions you do of correct movements, it is possible to do the function in a cleaner manner. Do you have any other questions? Any viewers, we have any questions you want to ask? Need not be about stroke only. If you want to understand rehabilitation further, speech therapy is a very new field, something you want to ask about. Okay, we have Shiva here. I'm 22 years old. How can I stop myself from getting a stroke? Is there a way? Oh, wonderful. Young gentleman, Thursday morning. So Shiva, to answer your question, yes, I think you missed out a slide. Strokes are preventable and treatable. So if you're a 22-year-old gentleman, I wish you were online. I would have asked you, do you smoke? Do you drink? Because strokes, one of the major risk factors for stroke is smoking, alcohol use, having an unhealthy lifestyle, especially if you're in a corporate setup where you're just stuck to your seat all the time. You might not have the time to move around, be physically more active. So if you look at these factors, if you can keep all these factors in check, get regular checkups. If someone in your family has diabetes, hypertension, or cholesterol, then probably you have a risk of having all these conditions which are hereditary in nature. So if you look at these factors and keep them in check, you can prevent your risk of having a stroke. We have Mridula. I always help my mother-in-law for her everyday activities because she takes a long time. A physiotherapist does not encourage that. Shouldn't I be helping? Okay, I'm sorry your mother-in-law had a stroke. To answer your question, I know there is a big temptation to help out these patients because they take a very long time to do their activities, and it looks like they're actually struggling to do it right. But first time they're trying to do something, if you help them there, you are setting an expectation for them that yes, help is available. So every time they'll look forward to that and they'll not put in that effort. And like I mentioned earlier, repetition is the key, and doing it in the right pattern or is very, very important. So every time if someone gives them that help, it's a burden for the caregiver or the care provider, or if it's you who's looking after your mother-in-law, it's an additional burden to you as well. The point is to get this patient independent. So every time if you're helping them with any activities they do, first is they'll not learn, and secondly it becomes very difficult for you as well. So your physiotherapist is actually right. Understand from your physio, how can you help your mother-in-law make it a little easier to do the movement. You understand the pattern and only give your help as much as it's required. And yes, let them do it themselves and learn it.
Are there any questions? Because some of the viewers may have a person who or a loved one who's had a stroke, so you may have any kind of inquiries, you can always ask us. We have Amit. Is there a case of stroke? If there's a case of stroke or paralysis, then can we come to Nightingale directly, or is it only when a doctor or neuro refers? What is the process?
So yes, the first step is if someone identifies that they've had a stroke, the first thing and most important thing to do is yes, go to a hospital first, get a confirmation that yes, it is a stroke. Get the whatever the cause for the stroke is, that has to be settled. Like example, if the blood pressure is shooting high above 200, that has to be settled first. Without that, rehabilitation cannot be started. So once the doctor clears you off saying that yes, your patient is now stable and can begin intensive rehab or a regular rehab 6 days a week or 3 days a week, depending on what kind of stroke it is, rehabilitation can be started at home. Well, in Nightingale's, there are patients as well who've had strokes for many years. So for them, it's not always essential that they get a referral from a neurosurgeon or a neurologist to come to us. If they know for sure, if they have a discharge summary or any hospital document which can help us with their history, then they're more than welcome to approach us. We can start their assessment first, chalk out a care plan for them, and then begin therapy.
Any more questions? We have Ishan again. One more question. Do I need to go to a stroke specialist or physiotherapy is enough?
Yes, like I said, depends on the patient again. So example, let me just use this example. If this patient is moving around, if this patient is walking, doing all activities, but they have a difficulty speaking, so obviously they come to a stroke rehab department, yes, but mainly for a speech and language pathologist, not essentially for a physiotherapist. There could also be situations where, again, this patient is walking, but it's very difficult for them to, example, if this patient is someone who needs to use their laptop a lot. So what's more important for them is to not just move the arm completely, but to use a laptop. So an occupational therapist becomes more important there. So again, depending on what the patient's goals are and what is possible in that particular patient, the therapist or the specialist from the stroke rehabilitation department will differ.
I hope that answers your question, Ishan. Where is your center located, Ishan?
So we Nightingales started in Bangalore. So we have 4 locations in Bangalore. I would actually want to ask you, where are you from, Ishan? Because in Bangalore we are in Indiranagar, Sahakar Nagar, Jayanagar, and Whitefield. In Hyderabad we are in Kukatpalli, Begumpet, and Madhapur. We'll be opening a branch soon in Dilshuk Nagar. And in Mumbai we are in Nariman Point, Dadar, and we'll be coming across in Santa Cruz soon.
So we have Mridula again. What is your opinion on Ayurveda and natural therapy? They claim 100% cure. I wish we could be in the same boat as people from Ayurveda, because I am not too sure. I don't want to comment actually about Ayurveda, whether it can provide 100% cure or not. But we are in an Indian setup where we believe in Ayurveda a lot. And because stroke is a condition with a disability which shows, it's a real concern for people, and they want the best possible cure. So Ayurveda, we call it alternative therapy. So many patients opt for alternative therapy. It might work for some, no doubt, but we have not particularly seen somebody being cured 100% and going back to their original state before the stroke. So maybe it works for some. It again depends on the disability. If someone's had a very mild stroke, that can probably, even without physiotherapy for all, it might get cured by itself. All the disabilities might disappear by itself, I'm saying. But if it's a very severe stroke, that 100% cure looks challenging. So we have Ishan again. Can I come to your center for treatment?
So in Bangalore, we are actually a home healthcare company. Our main focus is treating patients in their homes. But to support this, we have physiotherapy centers across Bangalore and Hyderabad, namely in Indiranagar, Jayanagar, and Whitefield. The reason for this physiotherapy center is we have many patients who are, with chronic disabilities and they require long-term care. So imagine we're treating them at home and we reach a state where the patient is completely independent at home. Now you need to get them back into the community, or maybe, get them back to their jobs. If it's an old person who wants to take regular walks in a garden, you need to get him out of the house. So how do you make the rehabilitation process more challenging or progress the rehabilitation for the patient? So this is the reason why we have physiotherapy centers, so that we can make it more challenging, the treatment for the patient, so that it's easier for this patient to go back and get back to their daily activities, which is outside the house, or you can say leisure activities. Shiva here, what medications are used to treat stroke? So to answer your question, Shiva, we as physiotherapists and speech therapists, rehab people, we don't prescribe medications. But if someone's had a stroke, they would ideally be under a neurologist who would, put them prescribe medications depending again on their symptoms. After that, they would be under regular follow-up with the same treating physicians or their neurologists, depending again if they have hypertension or diabetes, to keep these things in check. So ideally, most of the patients, as I said, ischemic stroke is more common. Most of the patients are on blood thinners and blood pressure medications, diabetes, cholesterol medications, mainly these to keep the patient in check so that they don't develop another stroke. One point I would like to cover here is home-based treatment for patients. So what our experience has been is the compliance to therapy is much better for patients when you treat them at home. The reason being, it's a stroke patient, they're coming to us because they're not able to move out, they're not able to walk. So when you treat the patient at home, you make it easier to access their services. They don't essentially have to come out to a physiotherapy center or go to a hospital to get treatment. And it's actually more difficult for someone who looks after them. I mean, the husband or the wife or the mother has to bring this person out of the house every day. And so even, they tend to take a lot of leaves from their job. So it increases the burden on the caregiver. So this bit is taken off when you treat the patient at home. And especially we have a specialty department itself here for stroke rehabilitation. So everybody is trained how to treat a stroke patient. Secondly, you can always involve those family members in the treatment, so they know exactly what's going on, and it's very motivating for the patient as well. So imagine we give them therapy for an hour in a day. They can repeat the same exercises in the evening with the help of their family members. So treating at home becomes very easy for a patient. They stick longer for their therapy. Otherwise, somebody who needs to take physiotherapy for 3 years, 4 years, it does happen, they drop out of therapy because they lose that motivation. So that is one aspect. Secondly, it's easier on their pockets. They don't have to spend all that money in travel if somebody comes home. Ishan, sorry, I guess I just answered your question there if you were with us, Ishan. Divya, would you like to, cover the bit when somebody is at home, the frustrations you have come across with patients?
Right. In a speech perspective, what happens is that now say you can't communicate. It's a very natural thing for a person to communicate, for a human being to communicate to the family member, to your loved ones. It's very, very frustrating when you can't do that, when you can't tell them what you want. Are you hungry? Are you thirsty? Do you need to use the bathroom? And you can't mention that to your family members. You know what you want to say, but you can't say it. So that, Akshita, can be very frustrating for the patient. And we need to understand that they're not being angry on purpose or they're not being temperamental on purpose. It's because of the frustration that's building up inside of them. We're all used to be living an independent life, doing our daily activities alone. And that's suddenly stopped now. I know what I want to say, but I can't say it, and that can be frustrating. Question?
Certainly.
Any questions?
So if that's all, thank you very much for your questions, your time, and your participation. I hope that was helpful. You understood something about stroke today, and if you will be able to identify the symptoms if someone else is having a stroke, it's very important that you pass this information on to others so that it's helpful for them as well. Thank you very much. Have a good day.